Thanks for joining us. My name is Jeremy Cantor. I'm here with my colleague, Erin Shigekawa. We work at JSI, usually in our California office in Berkeley, but now out of our living rooms and backyards. We're going to be talking about strategies for building and leading impactful collaboratives. Glad you could join us. We've been doing a lot of work with collaboratives across the state and the country, so a few of them. This has been actually a great opportunity for us to think a bit about what some of our key learnings and takeaways from this work over a number of years have been. We're looking forward to sharing some of that with you. Our hope is that this will be as interactive as we can make it. We're really curious to hear your input and your questions, and to be responsive to to the questions and areas of interest you have. So if you could take a second and just let us know your name, where you're joining us from, and one word you would use to describe multi-sector collaboratives. And you can do this in the Q&A box on at the bottom of your screen. Great, we got a couple of answers coming in. Nice to see. Okay, we've got transformative, impactful, egoless, interesting. Relationships. Impactful, empowering. Imperative, interesting. Partnerships. I'll give it one more second. And partnerships. Great. Thank you all. And if others want to continue chatting in, that's great. And anytime during the presentation, definitely feel free to chat us a question, ask us to clarify something we're talking about. We'll have a couple of spots where we pause to ask you for some additional input. So great. Again, thanks for joining. We've got a nice geographic spread, it looks like, of folks from around the state. We're going to cover four kind of key facets of impactful collaboratives. I'm going to cover the first two, numbers 1 and 2 here, and then I'll turn it over to Erin to cover 3 and 4. So the first facet that we want to discuss is how leading collaboratives is inevitably dynamic and iterative. And I often use this metaphor of a hot restaurant kitchen, right, where you've got sort of a vision, a goal. In this case, you've got a menu that's been established, but then on the back end there is so much activity. There's so many different dishes happening at the same time, and in a collaborative setting, that looks like attending to partnership development, thinking about evaluation and data collection, thinking about fundraising, thinking about how decisions are going to be made, thinking about physical infrastructure, and then thinking about what strategies you're actually going to put in place. And all of those have to be happening somewhat simultaneously, in the same way that in a hot kitchen, these dishes have to be developed. They have to be, they have to come out at the same time. You're running around sort of, checking, tasting, making sure everything's sort of staying at the right temperature. Another way to look at that, or think about that, is this model for thinking about these different elements of a collaborative: strategies, metrics, collaboration, resources, and leadership, that have to be attended to or developed over time. And they look different at different phases of a collaborative's development, right? The resource picture may look different at the beginning versus as a collaborative grows, additional partners come on board, additional strategies are implemented. So they're all interactive as well. As the strategies change, the metrics and evaluation approach is going to change, which leads to changes in the partners who are at the table and so forth. So in reality, actually, these lines look really tidy and straight. They really are sort of interwoven. They should be more like a braided, a braid than straight lines. So, all this is complicated and dynamic. One of the advantages of having this sort of dynamism and the breadth of capacity and partnership at the table is that you can be responsive to opportunities as they emerge, and respond in scale when significant crises arise. So Erin and I have been working recently pretty intensively with the East San Jose Peace Partnership. This is one of the California Accountable Communities for Health sites. And the Peace Partnership has been focused for a number of years on building a community-driven approach to violence and trauma in East San Jose. And when COVID arose earlier this year, they sort of had the right set of partners in the table set to be responsive, and they've actually become the conduit for hundreds of thousands of dollars going to support the immediate needs of families in East San Jose. And because of that, they've actually now their profile has shifted, and they're positioned to work even more broadly, and they're thinking about how to sort of impact the well-being of the community on a broader scale and on a broader time frame. So it really was this kind of capacity that they'd already set that's positioned them to respond to the crisis, and now to sort of leverage that as they move into kind of recovery and ultimately thriving. The second facet I want to talk about is the need for a clear value proposition. So value proposition can sort of sound like the kind of language of the tech startup, but I think it's really essential to building an effective collaborative over time. And to break it down a little bit, I generally think of a value proposition as answering three fundamental questions. What problem are we trying to solve, and why it's important? What are we doing about the problem? Why our strategies will work? And third, what are the likely outcomes, and who will benefit from that work? And if we can answer those three questions clearly and in a way that is aligned and tells a coherent story, then the value proposition will hold, and it provides an opportunity to engage stakeholders and build this effective collaborative over time. There's a lot more to say on this. We've actually developed a toolkit around sustainability that has a deeper dive on how to develop a value proposition. The link is here at the bottom of the page. And I think we can chat this out as well. So this sounds simple and straightforward. I will say, having worked on value propositions with dozens and dozens of collaboratives over time, it's actually quite complicated. So here's a very simplified version of what often happens in the initial attempt to put together a value proposition. When describing the issue, the answer is, well, this is the most critical issue our community is facing. The solution is a list of strategies, mostly services, many of which are already being done. And the benefits are that a ton of lives and money will be saved. Oh, great, that's the toolkits in the chat. It's a fine starting place. It's often, it makes sense. This is a little bit, simplified, and I'm being a little tongue-in-cheek in simplifying it this way. But often there's a lot of work then to be done here to actually figure out, okay, wait, why is this the most critical issue in the community? What sort of data do we have, whether it's health outcome data, or it could be the result of a needs assessment that this has been identified as a priority by community members. How are we really establishing that it's important and to whom? The solution. So, is the solution really commensurate with the outcomes we're saying we want to achieve, the benefits? Often there's a mismatch between those solutions and the benefits. The benefits are grand and really impactful, and the solutions may not totally line up. We may need to actually go back and review and say, okay, well, if what we want to do is, pick your big outcome, we want to save the healthcare system money. So are these strategies, do we have an evidence base that tells us that these strategies actually are likely to get us those outcomes? And on the benefit side, are we really clear on who will benefit? And I wanted to just dive in on this benefit question a little bit deeper and share this example from Be There San Diego. So Be There San Diego is also another California Accountable Communities for Health Initiative site. And they have launched a program called Neighborhood Networks. And Neighborhood Networks functions as sort of an intermediary linkage between the clinical and community systems, wherein individuals who are high cost, high need, and the clinical side and have unmet social needs get referred to neighborhood networks. They get connected with a neighborhood navigator, so functions like a community health worker, who ensures that they get access to and take advantage of community resources and services that they need. And I think they've done a really nice job here of identifying the benefits of their initiative and for whom those benefits accrue. So they've really identified their key audiences are community care organizations, healthcare organizations, and community residents, and then gone in and thought, okay, for these three audiences, what are the benefits? What will they see? So for the community care organizations, it's access to a revenue source. Right? Neighborhood Networks helps to manage contracts, so the money that's coming from the healthcare system actually can go to the community care organizations. Healthcare organizations have a conduit. They don't have to manage these relationships, these referrals themselves, and community residents get this relationship with a navigator to help them access services, address social needs. So let me pause there for a second, and we're also going to switch our slide sharing so Erin can take over. If you take a second, I saw some chats came in either through the Q&A or the chat, something that resonated with you or a question that you have based on this first part of the presentation that I've given.
Hey, hi everyone. I'm Erin Shigekawa, and we'll let some of those interesting chats come in and we can revisit them. And thanks so much for being with us today. We're really excited to have you. We thought that since we were in early morning session, people might not show with as much enthusiasm, but we really appreciate having our coffee with you this morning. So I'll finish up with number 3 and 4 of aspects of impactful collaboratives. And number 3 is to set an inclusive agenda. And I'll describe a bit more what I mean by this. One aspect of setting an inclusive agenda is to develop a shared analysis of root causes. And we know that one of the strengths of multi-sector collaboratives is that they work on really complex societal issues, and that's why it takes a multi-sectoral response to address them. So this is an excerpt, it's our adaptation of the Building Community Resilience model. And this is in recent work that Jeremy and I and others have worked on, which is at jsi.com/focusing the lens. And here you can see we're looking at the top of the tree, which is focused on kind of what is usually conceptualized as individual issues or within a family issues, things like domestic violence or maternal depression. But going deeper down to the roots of the tree, you can see the community causes and the social context, which might impact the things at the top of the tree. like violence in the community or poor housing quality and affordability. And this just speaks to having this shared understanding of the complexity of the issues that we're facing and the root causes of them. And this next example is from work that Jeremy and others at JSI have done about domestic violence and the really complex issue that domestic violence is. So you can see that it describes economic instability, housing insecurity, and substance misuse, and how they're bidirectionally related to domestic violence. So in other words, these issues can all impact domestic violence, and domestic violence can also impact all of these issues. And like I mentioned, the problems that people are trying to face through collaboratives are extremely complex, and that's one of the strengths of them. And I just had a conversation with somebody this week saying, if we can resist the urge to try to simplify everything, if we can try to embrace the complexity of the difficult issues that we're working on, that's when we'll really be able to solve things. And she was sharing, we should resist the urge to bullet things into 3 to 5 key solutions, and instead really try to embrace the multi-sector, multi-level interventions and strategies that it takes to address these really tough issues. So this again is the Focusing the Lens publication that we just put out this fall. And we looked a lot at language and framing of childhood adversity. So the second lesson here is that language and framing are really key for this developing an inclusive agenda. And what we did is we took a look at all the language that's being used in the field of childhood adversity or adversity experienced in childhood. And we talked to a bunch of folks in the field. We did a review of the literature. We looked at a bunch of different sources, and we came up with this, what you see here, this list of different terms that we were hearing over and over again. And through a deeper dive into the meaning of the language and the framing, we came up with these 3 findings. The first is that it's incredibly important to understand your audience and to understand that people will take in the same term and the same language in different ways. And one example here is the term toxic stress, which we're all familiar with. And as you know, for a policymaker, perhaps toxic stress indicates an urgent call to action, or that this is a societal issue that we really need to address. And maybe it's the same for a clinician. It indicates a sense of urgency and kind of a moral imperative to address it. But perhaps for a parent or a community member, toxic stress can sound very different. It can sound really negative. It can sound very difficult to overcome, and it can sound scary. So just understanding the audiences is extremely important to deciding which language to use. The second finding is that aligning language with desired strategies is really important. And the main thing that we're talking about here is that language can indicate a problem is individual, family, community level, or a different level of intervention, and that the language that you use should align with the strategies that you're interested in. And the third finding is that no single term or concept is sufficient to work for everyone. And an example here that I'll share is the term resilience. So we've all heard of resilience being portrayed in a positive light, resilience as a strengths-based approach, but we've also heard some pushback against the term, and that resilience can frame what is a social issue and a societal issue with the onus on the individual to just be tough enough or just lift themselves up to overcome these challenges that they're facing. So this just describes that there's kind of 2 sides of every term, and to be mindful that there's no single solution to language and framing of these complicated issues. And then also in this same report, we took a look at different legislation and different uses of the words that we found to be most common. I'm not sure if you're seeing my video, so I'll just move this over. But as you can see, there's a huge uptick in the use of these different words in childhood adversity starting around 2013 to 2014. And the main point of these different graphs is just to show how different bodies are using the language. So this is California state legislation introduced, not passed, but introduced. This is, oops, not advancing. This is congressional legislation at the federal level, and you can see all of this in more detail in the report. And this is terms in popular media, and I'm going through it really quickly just for the interest of time, because I hope that we have time for a couple questions. But the usage differs between policymakers and the lay public, and I think that goes for any audience. So just kind of underlines the importance of language and framing. So the fourth pillar of impactful collaboratives is that collaboratives move at the speed of trust. And I know that we've all seen this quote on motivational posters in schools across America. And it's, if you want to go fast, go alone. If you want to go far, go together. And this work, this visual, is from work that JSI and Jeremy has done with the Georgia Health Policy Center through Aligning for Health, a part of the Robert Wood Johnson Foundation's initiatives. And this was a deep dive into collaboratives and how they work as it relates to equity. And what they found was that while funders are really emphasizing data and finance and governing, what was really key to the success of the collaboratives was the ability of site leadership to set the conditions for trust and relationships over time. So you can see from the visual, trust and relationships are key to governance and purpose, and especially to strategy. And this made me think of work I've done previously back in Michigan at a community collaborative that involved folks in Detroit and Ann Arbor around community research related to health equity. And this collaborative has been going for about 30 years. And when I first started working with them, they shared that they spent an entire year on norms, a whole year on building trust and relationships and talking about their process for decision making. And I think it's shown through the longevity of this partnership that foundational trust has been extremely important. And so here we have just a couple tips on kind of building the trusting relationships for collaboratives. The first is that conversations about power and equity are foundational, and there has to be a recognition that everyone doesn't come to the table with the same amount of power. People who have typically been in a position to decide what gets funded or where to allocate money come to the table with a different amount of power than, say, community members or CBOs who are often applying for those funds. The second lesson is to measure trust, and that if we really value trust, we need to measure it. And that can be through a survey of your members, it can be through focus groups, but some way to gauge the sense of trust, belonging, and relationships within a collaborative. And the third is to be explicit about decision-making, where it's a move from community input really to community partnership and engagement. And I think the work that Jeremy mentioned earlier with the East San Jose Peace Partnership is a great example of really community-led leadership. And this is, as you may know, the song, The Room Where It Happens from Hamilton. So we just think it's important to be mindful of who's in the room where decisions are being made and who has a seat at the table where these decisions are being made. And if it is inequitable, what can you do to change that? So just to recap super quickly, the lessons that we described were that impactful collaboratives are dynamic and iterative. They have a clear value proposition. They have an inclusive agenda, and they're really focused on trust and relationship building. So we've shared our contact information here, and we'd love to take any questions if you have any questions. And I'm going to stop screen sharing so I can read your comments.
Hi, Jeremy, there was at least one question about the chat box. And so just to make sure everybody knows, the chats and those Q&As will be posted afterwards so people can see who else was here and certainly all of the one words that you inspired. Lots of urgency. So I'm looking forward to what we're going to do going forward to improve children and family in California. Any questions for folks right now? We wanted to make sure you gave them a minute. And I know that they rushed, and I'm glad that they left the links so that people can follow up with the materials. Again, today, as well as the first 2 days and next week, all of the presentations will be posted, as well as the PowerPoints and the resources. So we look forward to continuing this dialogue in the new year, because I think our hope is that this inspires you, fires you up, and then makes you think, well, what else can we be doing? I thought Jeremy's 3 questions in the beginning was a great way to get started. There's one question here. Any ideas for how you might work with public sector agencies? How do we want to engage them? Some good clues, and then we'll see if Will agrees with you at the end of the day.
Right, exactly. Yeah, it's a great question, and I mean, I think most of the collaboratives that we work with have public agency partners. In many cases, the public agency is functioning as the backbone organization and the hub of these collaboratives. And you know, I mean, I think as with any partner, it's critical to sort of understand the motivators and what benefits are of value to that partner. And certainly that's the case with public agencies. I think kind of understanding the what their, you know, what success looks like, what they're being held accountable for, and then how the collaborative's activity and goals align with those factors, those measures, you know, the motivators. I think this question is, I like this angle of it, of sort of how to think bigger. And you know, I think I've seen a lot of instances where a kind of, you know, big aspirational goal can be a great motivator for multiple partners. I mean, whether they're public agencies or otherwise, but you know, really sort of laying out an ambitious goal, and then you sort of start with the commitment to that vision and goal, and then sort of work back to, okay, you know, right? I mean, it's in that value proposition sense, like, okay, we sort of see where we're going, what the outcome looks like. Let's work back and figure out, are there some sort of intermediate goals that we think are sort of are checkpoints on the way to that big ambitious goal that align with the responsibilities and interests of that public agency partner. And I think the other piece that I know some of the collaborators that we work with have focused on is, you know, sort of who are the champions that have influence over those public agencies too? Are there, you know, members of the board of supervisors to whom they answer? And if the board of supervisors states that this is a priority, then that sort of creates tailwinds, right, for a collaborative and for the public agency then to fully participate in this kind of longer term ambitious effort.
Thanks. Erin, what would be your takeaway to accelerate building trust so that it doesn't take a year?
That's a good question. I think definitely valuing the input of community perspectives and letting go of some of the rigidity of focusing on only focusing on things that are evidence-based. I think what we know is that communities have a lot of the solutions already, and that the rest of the people in the room need to listen to those solutions and uplift community voices, and really look to people with lived experience to inform what would best support them. So yeah, I think lifting up the constraints, not being solely focused on evidence-based, being open to things that are emerging practices or showing promise in smaller groups or in communities.
Well, I'm sitting here smiling because we couldn't have had a better segue to Voices from the Field with a panel of parents and family members happening in 1 minute. And on behalf of Breaking Barriers and all of the folks that have been listening to this, thanks, Jeremy and Erin. As once again, like last year, you've inspired us and fired at least me up, and I think others as well. So thank you. Look forward to the ongoing dialogue. And if everyone would just click on the next session, and where we're going to have a panel of successful, innovative, and resourceful family members and agency heads from around the country, around the state. Looking forward to it. Thanks so much, Jeremy and Erin.
Thank you. Thanks, everyone. Be in touch.